Welcome to Lesson 13. In this lesson, we will study ICD-10-CM Chapter 10, which covers diseases of the respiratory system, coded from J00 to J99, along with U07.0 for vaping-related disorders. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. Lesson objectives. In this lesson, you will learn how to correctly code COPD and asthma, acute exacerbation versus infection, acute respiratory failure and sequencing, influenza coding rules, ventilator-associated pneumonia, vaping-related disorders. We will also highlight common CPC exam traps. Chapter 10 Exam Importance. Chapter 10 is high yield for exams. Many students lose marks due to confusion between acute and chronic conditions, incorrect principal diagnosis selection, missing documentation requirements. Careful reading of the provider documentation is critical. COPD and asthma overview. Chronic respiratory diseases commonly tested include COPD, coded to J44, asthma, coded to J45. ICD-10-CM clearly distinguishes between uncomplicated cases, cases with acute exacerbation. Acute exacerbation, key concept. An acute exacerbation means a worsening or decompensation of an existing chronic condition. It is very important to remember, warning, an acute exacerbation is not the same as an infection. An infection may trigger an exacerbation, but they are not coded the same way. COPD with acute exacerbation. Assign a COPD code with acute exacerbation only when the provider specifically documents acute exacerbation. For example, J44.1, COPD with acute exacerbation. Never assume exacerbation without documentation. COPD with infection. If COPD is documented with an infection, assign COPD with acute lower respiratory infection, plus a code for the specific infection. Do not confuse infection with acute exacerbation. This is a very common CPC exam trap. Asthma coding. Asthma codes distinguish between uncomplicated asthma, asthma with acute exacerbation, asthma with status asthmaticus. Always code exactly as documented by the provider. Acute respiratory failure overview. Acute respiratory failure is coded to J96.0 acute respiratory failure, J96.2 acute and chronic respiratory failure. Correct coding depends on why the patient was admitted, how conditions are sequenced. ARF as principal diagnosis. Acute respiratory failure may be assigned as the principal diagnosis when it is the condition chiefly responsible for the admission. Coding is supported by the index and tabular list. However, always remember, warning chapter-specific guidelines take priority. ARF as secondary diagnosis. Assign acute respiratory failure as a secondary diagnosis when it develops after admission or it is present on admission but not the main reason for admission. ARF with another acute condition. When acute respiratory failure occurs with another acute condition such as myocardial infarction, cerebrovascular accident, aspiration pneumonia, the principal diagnosis depends on the circumstances of admission. If documentation is unclear, query the provider. Influenza coding overview. Influenza coding is an exception to the uncertain diagnosis rule. Three main categories are used: J09 certain identified influenza viruses, J10 other identified influenza viruses, J11 unidentified influenza virus. Confirmed influenza. Assign J09 or J10 when the provider confirms the influenza type. Laboratory confirmation is not required. Examples: avian influenza right pointing arrow J09, H1N1 or H3N2 right pointing arrow J10. Suspected or possible influenza. If the provider documents suspected, possible, probable influenza, you must assign J11. Do not assign J09 or J10 in these cases. VAP documentation rule. Assign J95.851 ventilator-associated pneumonia, only when the provider explicitly documents VAP. Warning: never assume VAP just because a patient is on a ventilator. VAP additional codes. When VAP is documented, assign J95.851. Assign an additional code for the organism, if identified. Do not assign pneumonia codes from J1 to J18. VAP developing after admission. If a patient is admitted with pneumonia and later develops ventilator-associated pneumonia, then the admission pneumonia is the principal diagnosis. VAP is coded as an additional diagnosis. Vaping-related disorders. For conditions related to vaping, assign U07.0 as the principal diagnosis. This code captures lung injury due to vaping. Vaping with other conditions. For vaping-related lung injury, assign U07.0 only. You may also assign additional codes for acute respiratory failure, pneumonitis. Vaping symptoms. Do not code separately. Cough, shortness of breath. When a definitive vaping-related diagnosis is established, gastrointestinal symptoms may be coded separately if documented. COVID-19 note. When pneumonia is confirmed due to COVID-19, follow section IC1, G.1, C, I. COVID-19 coding rules override standard respiratory guidelines. Chapter 10 Exam Traps. Common mistakes include treating infection as acute exacerbation, assuming ventilator-associated pneumonia, using wrong influenza category, incorrect ARF sequencing, coding vaping symptoms separately. Avoiding these errors can significantly improve exam scores.